Welcome. This is Dr. Subramanian presenting the e-version of an article published in 2017. The study was conducted in 2016. The topic is on impact of smartphone usage among college students, and it's an analytical study. Now the technology has become our day-to-day life. It has huge implications as far as the studies, academic, personal, and networking. So this scientific study where we have conducted an observational study among college students with 13 questionnaires into December 2016, and how the smartphone usage affects the health among college students. That's what the study is intended about it. So the results, as you could see, this is the abstract. 74% were female, and more than 66% had a habit of checking the smartphone while sleeping. So excessive usage of smartphones can lead to so much of health hazards, including hormonal disturbances, to about weight gain, lack of focus, and with cognitive problems, with inability to focus on their studies, along with arm and neck pain. So having known the hazardous effect of smartphone, college students especially should be more careful of how judicially the smartphone can be used for the academic purpose, like taking notes, storing notes, or communicating with the experts, and having a control of the usage. That's the abstract, the essence of this study. So as I've already told you, modernization and an advancements in the technology where communication, especially in the field of communication, wireless communication has become order of the day. It's a mobile culture, and where social interaction face-to-face may not be there much, and it has some of the known health hazards, right from headache to irritability of the eyes, and these are all known things. And this is the aims and objective of this study. We were trying to find out, it's a cross-sectional study, trying to find out frequency and merits and demerits of using smartphone, especially among the college students. The purpose of this study is this can be helpful to obtain more data related to social health care. So it tries to analyze the good side and the bad side of excessive usage of smartphones on health. So here is the materials and methodology. This is an original study which was conducted in Chennai metropolitan city in December 2016 among 115 undergraduate college students aged between 17 to 25. And now we have collected data regarding the age, gender, and probably living situation, how long they try to use, sleep quality, any arm pain, neck pain, and these are all the things what we are trying to use, and of course how long they were using this smartphone daily. So we have excluded non-smartphone users. So here comes the data analysis. So having collected the data from 115 students, so here are the data, what it says. Nearly 74% of the participants were female, and women students spend more than 10 hours a day, more than their male counterparts. the duration of longevity of using the smartphone, especially where more 3 to 5 years they were using the smartphone among 65% of the participants, and more than 77% of the users were using more than 5 hours per day. And this is more which is supported by a study from Goa among UG students by Savio et al. In 2016, where excessive usage of smartphone for social activities, maybe for games, online videos, and Facebook, which is being supported by one study. And 79% of this study subject had headache, 51% had anxiety. Along with that, the ill effects of excessive smartphone usage were, lack of sleep, we call it as insomnia, arm and neck pain, along with eye pain, and more important thing is it also reduces the ability to focus. The attention span gets lowered. Also, the cognitive ability, the time taken to read a particular topic, be the focus, analysis, cognitive decline, were being recorded with the excessive smartphone usage among especially college students. Let's see now. So here goes the discussion. The negative impact, where it is an UK-based study by Sanjay et al. In 2009, where they say men were excessively found to be using more, they have a phobia not to use the mobile phone. Again, a study. Again, another study, it's a Japanese study conducted in 2016, who they say, smartphone adversely affect one's ability to focus on any given task, and there is again another study by Gautami and Vental in 2016. Even the social behavior, culture, moral, the behavioral changes are also there with excessive usage of the smartphone or the mobile technology, we can say. And as we have seen, many of the participants of this study were using more than 5 to 6 hours per day. The ill effects of using excessive smartphone can, especially among youngsters, can affect the mental health of the individual. This is being supported by Bhargava et al. In 2014. So positive impacts there, all of us know about it. In an educational purpose, if it is smartphone is used, anytime learning, anywhere learning, and better accessibility. You have the knowledge in your hand, and probably sitting at home, you have an access to gain more knowledge if used in a proper way. That's more important. So target to improve the skill, knowledge of an academic candidate student, college student for the academic purpose can more be facilitated. This is a positive side of using a smartphone. And the one more important thing is like, Srivastava et al. In 2005 was highly recommending online education to be integrated into the normal the education system. So what he says is it is possible for the students to broaden their academic knowledge, and they can communicate with experts globally anywhere in the world. So these are all positive aspects of using a smartphone, especially exclusively for the academic purpose. During the exam times, they can equip well, they can retrieve the information what is stored in the smartphone for better purpose, which is being supported. Now, having said the positive impact, let's see the limitation of this study. This study where we have used only, it is only an observational study, and it is only represents only one metropolitan of Chennai, and there is no intervention being provided, no physical intervention or drug management or how to overcome. These are all the limitation. Also, the musculoskeletal disorder, visual problem were not psychological evaluation were not done by exclusive professionals. These are all where 13 questionnaires were used. It is only a subjective recording which forms basic for this study. So these are all the limitations of this study. And so when we conclude, Definitely, a smartphone have a better impact on the society, especially the learners, the teachers, and the students. Though the technology has come where education, learning, knowledge, and skill can better be utilized, but of course, it requires an accountability and a responsibility by the younger generation, knowing the deviation from the learning part, deviating to the social media should be curtailed, and the longer duration of using the smartphone, they should be familiar and aware of the ill effects of excessive smartphone usage, as we have seen from eye problem, cognitive decline, developing arm and neck pain, as we have said. So having known this thing, it is the individual students who should control, who should exercise of how wisely smartphone can be used for improving their academic performance. And I'm sure the study, which is published in our esteemed journal, will find it more useful. Thank you. Lila?